Hi, my name is Nancy Silva-Mullins, and I am a pelvic floor physical therapist with Northwell Health. Today I'm going to be talking to you about some helpful tools that we use in the clinic to manage pelvic pain. So what exactly is pelvic floor physical therapy? It's a non-surgical approach to rehab of dysfunctions in the pelvis that contribute to bowel, bladder, sexual health, and pain complaints. A lot of what we do is patient education so that we can give you the proper tools for your toolbox so that you can self-manage your symptoms. As you can see, we treat a lot of different conditions, but for the sake of today's lecture, we're going to be focusing on the treatment of just pelvic pain. Looking at this, these are some things that we do in order to treat pelvic pain. Again, we spoke about patient education. So what is that exactly? It could be anything from bladder diaries, urge suppression techniques, diet suggestions, to proper posture. All of this impacts your symptoms. We also use therapeutic modalities to decrease pain, manual therapy techniques to decrease trigger points, and relaxation and stretching techniques to just improve overall flexibility. Ultimately, once we achieve all of these things, then we can look to strengthen any weak pelvic floor muscles. Electrical stimulation is a non-addictive, painless, and relatively easy way to help reduce pelvic pain. The electrodes can either be placed on the skin of the painful site, or we can use an internal vaginal or rectal probe that will deliver the stimulation directly to the pelvic floor muscles and the surrounding tissues. That could be the source of the pain. We do use different types of frequencies. There's interferential electrical stimulation. This is used for deeper penetrating tissues, or we can also use TENS, which is transcutaneous nerve stimulation, to stimulate the nerve in order to block the pain. Regardless of the type of stimulation that we use, or if it's external or internal, studies have shown that electrical stimulation has been very beneficial in the treatment of pelvic pain. Low-level laser therapy, or LLLT, is a form of cold laser which uses only light energy to stimulate healing at the cellular level. Surprisingly, the patient does not feel any heat from its use. It promotes vasodilation, which increases blood flow to the area and initiates healing in the tissues. This ultimately decreases any muscle spasms, it inactivates trigger points, and it can alleviate pain and inflammation. Personally, I like to use the laser to the rectal area prior to doing any manual techniques. I found that the patients tend to relax those pelvic floor muscles a little bit more to allow me to do more treatment on them. Lower quarter stretching. Many people underestimate how important stretching is. For example, if you're someone who is sitting at a desk all day, this can equate to tight hamstrings and tight hip flexors, which in turn causes tight pelvic floor muscles, and then ultimately can lead to pelvic pain. So it's important for us as physical therapists to look at the person as a whole and not just hone in on their pelvic floor muscles, because then we may be missing an important piece of the puzzle. Manual techniques are a huge component of what we do in pelvic floor physical therapy. We may use myofascial release, we could do trigger point release, muscle energy techniques, or as shown in the picture, a type of massage technique which is called Thiele Massage. This can be performed either transvaginally or transrectally, with the patient lying flat on their back or on their side. Again, regardless of what position we use, we try to make sure that the patient is comfortable and that they're draped accordingly so that they can relax more to allow us to do more on our part. Viscera refers to the internal organs of the body, such as the stomach, the bladder, the intestines, and these organs actually need to glide in order to work properly. When the organ does not have optimal movement and gliding, then this actually impedes on its ability to perform its physiological functions. So what we do with visceral mobilizations, it's a gentle form of manual therapy that helps to release any restrictions and allow for those organs to move properly again. Skin rolling is a form of myofascial release that we use to identify and treat areas of restriction within painful areas of the body. This can often result in pain, loss of motion, or pressure in that area of restriction. With the skin rolling, we're literally lifting up the skin and pulling it away from those restrictions in order to break up any adhesions. Often patients will have redness or heat to that area that we worked on. They may complain of feeling some soreness. Believe it or not, these are all good signs that it was working. Abdominal massage is an advanced massage to the abdominal pelvic region that we use to treat a lot of gastrointestinal issues, such as constipation or bloating or pelvic pain. We use small little circular motions, starting at the right ASIS, coming up, across, and down. We're basically following the direction of the normal colon mobility. We tend to do this a lot in the clinic, but we also teach our patients how to do this specific technique at home to help them have greater ease with defecation. As a physical therapist, we want to emphasize that coming to the clinic 1 or 2 times a week is not going to cure your pelvic pain. The patient really has to take onus and want to actively participate in their treatment plan. So if manual techniques are beneficial to the patient, a lot of times we recommend that a patient purchase a pelvic wand, which will allow for greater ease performing any self-trigger points or massage to the pelvic floor muscles. Today I'm not going to be advertising any wand over another. I just wanted to show you that there are many different wands on the market. Biofeedback is a big buzzword in pelvic floor physical therapy. It is a way to retrain your pelvic floor muscles. For those patients with pelvic pain, often their muscles are short and tight, and the goal of the biofeedback is to help them understand how to be aware of these muscles and to learn how to relax those muscles in order to decrease that pain. We can use electrodes either on the surface, or again, we can use electrodes that are inserted into the vagina or the rectum. Using a computer screen or a handheld device, the patient actually gets information or feedback to gain more awareness and help them to improve that resting tone. A lot of times with patients who have pelvic pain, I'll teach them a technique of bulging their pelvic floor muscles, which is a lengthening technique. Breathing is so incredibly important. A lot of times when we are under stress, we perform a shallow breathing pattern, and most people with pelvic pain will display this pattern. So we teach them this technique in order to promote relaxation. Vaginal dilators, or trainers as they've recently been referred to, come in all different shapes or sizes. Again, I'm not recommending one over the other, but as you can see, there are silicone dilators and plastic dilators, ones that have magnets to promote increased blood flow, ones that vibrate, and also ones that start at a very small circumference, and then after they're inserted into the vagina, you can push a button and then the circumference actually increases. Regardless of what you get, they are very beneficial for patients with pelvic pain. They provide a prolonged stretch to the tissues and allow for greater ease with penetration. Penetration doesn't necessarily have to be only for intercourse. This can be to help patients be able to insert tampons or just have greater ease during a pelvic exam. Therapeutic stretches, again, very important. we are trying to teach patients things that they can do on their own to maintain all the good work that we achieve within the clinic. I always like to point out to my patients that stretches should be held for a bare minimum of 30 seconds, because this is how long the spindles within the muscle fibers take to actually be stretched. So holding a stretch for less than 30 seconds is kind of a waste of time. So really push it 30 to 60 seconds. Going to see a pelvic floor physical therapist to treat your pelvic pain is really not going to cut it. Treating pelvic pain is a multidisciplinary approach, and so in order to really kick this thing in the butt, you should have a really good team. So I encourage everyone to seek out, pelvic pain docs, sex therapist, proper urologists, GIs, or whatever that you may need. I appreciate this, and thank you so much for your time. Take care.